Hi guys, this is Dr. Priyanka Mehta, gynecologist and women's health expert from Diva Women's Center, Chennai. Endometriosis. This is a diagnosis which we come across when young girls and women go for an ultrasound. An ultrasound is done when somebody is having severe period pain and that is not relieved by the simple painkiller tablets and simple remedies. So what exactly is endometriosis? What is the theory? What happens? What are the different types of endometriosis? What is an endometriotic ovarian cyst? Does it need surgery? Will it affect my future fertility? There are so many questions that young girls and women have to ask. So I will just try to answer a few of the questions, but it would be nice if you also give your opinion and your comments, and you can ask questions so we will be able to answer it better. So in endometriosis, normally when we see menstruation every month, every 28 to 30 days, there are periods which could be for 2 or 3 days, and after the period stops, maybe during period sometimes there is some pain, and usually after period stops, the pain goes away. But in this problem called endometriosis, the theory is that some amount of bleeding will also go inside your abdomen or your tummy. So basically, not only are you having periods, so the blood is coming out from the uterus, but also some blood, because the uterus will communicate with the fallopian tubes, and so some amount of bleeding also goes back inside the abdomen, and this bleeding inside the abdomen will cause all the symptoms of endometriosis. Now, the symptoms of endometriosis are, first important symptom is dysmenorrhea. That means there is severe pain during the period. Sometimes this pain will start just before the period. It will be there during the period, and it really affects the quality of life. The woman or the young girl is not even able to go to school or college or their work sometimes. And it will also continue for a few days after the period is over. This is because with endometriosis, because some bleeding is slowly happening inside your abdomen also, this bleeding will cause more blood flow, and there is we call it pelvic congestion. So the entire lower part of your body will feel very heavy. Some girls and women will have chronic pelvic pain. That means all the time they have some kind of discomfort or vague pain in the lower abdomen. For women who are planning pregnancy, sometimes it causes infertility. For married women, or if you are planning for a baby, sometimes it may take longer time to conceive, because this endometriosis can either block your tubes or affect your egg quality, or sometimes the entire environment inside is not favorable for a pregnancy. Also, sometimes women can face dyspareunia, that means painful intercourse. Sometimes even passing motion becomes very difficult, that's called dyschezia. So on the whole, it is a very chronic and very distressful condition for the women. How can we diagnose endometriosis? So usually when there is a dysmenorrhea or a period pain, we give some hot water bath, we give a hot water pad to keep, or we give painkiller tablets, we give paracetamol, and sometimes we give some other tablets also for the pain relief. But when pain relief is not at all happening with all these medications, we sometimes start with a hormonal contraceptive pill, which is a combination pill for 2 or 3 months. So this also may or may not help. And then we ask them to do an ultrasound, and sometimes in the ultrasound we are shown the report of an endometriotic cyst. So this whole endometriosis, where the blood is slowly collecting, or there is bleeding happening inside, sometimes this can happen in the ovary. So a normal ovary is around this big only, 3 to 2 into around 1 centimeter. And slowly as blood collects inside, this ovary will just keep increasing in size, and that forms an endometriotic cyst. So do you need to do a surgery for this endometriosis? So whenever someone has these symptoms, we have to treat depending on what are the symptoms, what is it that they're looking for. So for a young girl who is in her early 20s or in her teens, and she has a lot of pain, we initially start them on painkillers. We can even start on a 3-month course of a combination hormone pill, so that we are stopping the regular hormone levels, and we give these hormones from outside and see if their pain is reduced. We do an ultrasound. In the ultrasound, sometimes everything is normal and still they are having a lot of pain. So there are some other progesterone hormone supplements or combinations available which we can try for endometriosis. But if someone is planning for a baby, they are trying to conceive, and there is an endometriotic cyst and it is big enough, sometimes we need to do a surgery, so that we just do a laparoscopic surgery in the best hands available and just remove that ovarian cyst rather than removing the ovary. Problem with endometriosis is that till you are having your periods, it may keep coming again and again. So many of the women who suffer from endometriosis sometimes need repeated surgeries. So the first surgery has to be done in the best way, and after surgery, depending on if you're planning a baby, then you have to do the treatment for that. Or if you're not planning a baby, or if you have children and you don't want the fertility treatment, then we give some what is called as suppressive therapy. So sometimes endometriosis may need either a lifelong treatment or a treatment for a longer duration, so that it doesn't come back again. So don't take your period pain very lightly, especially if it is preventing you from doing your regular activity. Periods do cause pain, but most of the common kind of pain is relieved by painkillers, and usually you don't need to take time off work. If that's how we say, like in a month or in 3 months, if the child has to be like a school going girl is taking off on each and every period time that she's having such severe pain, we should be suspecting endometriosis, because the problem starting and the diagnosis interval, many studies have shown that sometimes that clinical presentation to diagnosis sometimes even takes 10 years, because we just keep taking different kind of painkillers. So if your pain is very, very severe, you are not able to do your work, you have to take time off work, simple painkillers are not working, have the suspicion of endometriosis, get an ultrasound done and take the appropriate treatment for the same. Thank you and take care.